Okay. EJ?
Yep, I'm here.
Okay, would you like to start?
Oh, yes. Hi. Hello, everyone. I'm EJ Ashbourne, the Executive Director of PQMD, along with Jen Zolkos, the Director of the PQMD Community Practice, an online global health forum committed to advancing quality donations worldwide. And I want to thank everybody for joining us for the PQMD Pillar Talks Community of Practice webinar series. This is several into our experience doing this, so we're very excited that you have joined us today. For those of you who are not PQMD members, I'd like to just give you a very quick overview of what we do. It's the Partnership for Quality Medical Donations, and we are a global alliance committed to advancing the role of donations worldwide with 42 members representing leading international and US-based NGOs and global healthcare companies in the pharmaceuticals, medical products, and device fields. We were founded in 1999. Our work is guided by 5 pillars: humanitarian assistance, health system strengthening, disaster response, guidelines and standards, and knowledge and innovation. By virtue of our network, our members leverage their partnerships, expertise, and resources to focus on building sustainability, promoting community resilience, supporting disaster preparedness and response capacity, all while adhering to the highest standards of excellence in donation practices. Today's event will focus on the Global Health Security Agenda, also known as GHSA, why it was created, and how you can or might be interested in engaging their work on global capacity building and mitigation of pandemic threats worldwide. We will also review GHSA tools and resources and what they can do for you and the work you are doing. We are very lucky today to have with us Ambassador Bonnie Jenkins, and those of you who have been at previous global policy forums would have had the opportunity to meet her when she's been with us before, and we're very excited that she is here with us today. The ambassador is the founder and president of the nonprofit organization Women of Color Advancing Peace, Security, and Conflict Transformation, otherwise known as WCAPS. She is also a non-resident senior fellow at the Brookings Institute and president of the Global Connections Powering Global Change, where she works with several academic institutions on issues of global health, infectious disease, and defense innovation. Prior to this, Bonnie was a visiting fellow at the Brookings Institute and the University of Pennsylvania's Perry World House. As ambassador of the U.S. Department of State from 2009 to 2017. She served as coordinator for threat reduction programs in the Bureau of International Security and Non-Proliferation. And clearly, as you can see, incredibly impressive credentials. So thank you so much again, Bonnie, for being with us. And with that, I am going to hand it over to Jen Zolkos for some housekeeping about this session. Thank you very much.
Thank you, EJ, and thank you everyone for participating. For everyone's convenience, please, we ask if you can put mute on your phone and on your computer so that we're able to hear the presentation. This session is being recorded, and so it will be available on the Community of Practice, which is cop.pqmd.org. And the webinar will consist of a 30-minute presentation followed by 10 minutes for questions and answers. And you can find your question and answer button on the bottom of your screen, and all you need to do is just put in your question, and we'll take questions at the end of the presentation. We will also have a continuing conversation on the PQMD community of practice, so if you have not joined, please do so. The information will be up on your screen at the end of the presentation. And I guess now I will hand this over to Bonnie. Bonnie?
Hi, thank you, Jen, and thank you everyone for joining us. I trust that everyone can hear me clearly. It's really an honor to be able to speak again with some of you about the Global Health Security Agenda, and I really do look forward to questions after I go through these slides and give just a background for those of you who are not as familiar with it on the GHSA, and also to share some thoughts about ways in which you can get more engaged, to include providing some contact information. Let's start with just talking about what is the Global Health Security Agenda. And after much discussion that took place within the U.S. in 2013 regarding issues of infectious disease, we decided to develop an initiative, and I'll talk, of course, a little bit more about it, but here I just want to say what it is. And what the Global Health Security Agenda is an effort, as you can see, to attain a world safe and secure from global health threats posed by infectious diseases, whether natural, deliberate, or accidental. And the last few words are important because there was a recognition in the U.S. that infectious diseases are important and should be looked at by all parts of the government that look at different issues dealing with whether a disease is natural, deliberate, or accidental. So in the case of in my own situation, for example, I do work on biosecurity issues, which is preventing non-state actors with intent to do harm from getting their hands on biopathogens and use those as biological weapons. So this GHSA effort pulled me in because of the work that I do on the deliberate side. And in that respect, other parts of the U.S. government, and I'll show you a slide that outlines of different parts of the U.S. government involved in GHSA, but other parts of the government are involved in the natural or accidental aspects, and so they got pulled into the GHSA through their own missions. One of the fundamental aspects of GHSA is the recognition that these diseases pose not only a local threat, but is also an international health security threat. We wanted to raise the level of attention and recognition to the global community, including U.S., but also overseas, about the importance of infectious disease. This is something that we need to pay attention to because it really does impact us in security as well as health. GHSA is a multisectoral effort. In that respect, as I had mentioned earlier, it's an effort that really involves bringing in different parts of the government, because you really do need all the different parts of government to be a part of this strategic effort. And each entity has a specific role, but having everyone work on a strategic goal is really one of the things we realized we really needed to do to make this successful. We also realized early on that we had to work with the relevant international organizations that are involved in infectious disease work. So that, of course, includes the World Health Organization, but also the Organization of Animal Health and the Food and Agriculture Organization. This brings us to the next bullet, which is realizing that this is a One Health issue. This is important because, as you know, over 60% of the diseases that humans get come from animals. So if we're going to be looking at reducing and preventing infectious disease of humans, you have to bring in the vets and those who work on animal health issues, but you also have to look at food safety and look at what we eat to make sure that we're not getting diseases by what we intake in our bodies from food. And finally, and also importantly, something I worked a lot on, I was the U.S. lead for this effort, which is bringing in the non-governmental sector. We realized early on that we cannot address issues of infectious disease unless we bring in the multitude of entities that work outside government on these issues. This includes everyone from the private sector and pharmaceutical companies to foundations, to academic and research institutions and think tanks. This had to be, as we would call it, a multi-whole society approach, not just a multi-sectoral, a whole of government approach. We realized, and going back a bit, we realized that we needed to concern ourselves with this issue of infectious disease because of what we were seeing happening. We were seeing increased number of diseases, the increase in costs. Here, SARS cost $30 billion. The anthrax attacks, which was much more of an intentional cost, $1 billion to clean up. And so we had realized in 2013 there were all these factors that were leading to a situation where we weren't really, as a global community, able to really deal with the issue of infectious disease. So as a result of continuing discussions that took place in 2013, this is what led to the decision to do a GHSA, and that led to the launch of the GHSA on February 13, 2014. I do want to note here that this was before Ebola. So before Ebola became what we learned it to be, which was in March of 2014, we had already launched this. And I think that highlights the importance of the GHSA and the recognition already that the global community was not ready to deal with an infectious disease threat. And so we had this real launch on February 13th in 2014. And it was actually a snow day in Washington, D.C. So all the buildings were closed, all the government buildings were closed, except for the Health and Human Services. And we had about 22 ministers who were able to make it in before the snow, go to HHS that morning, and we had our launch. At the same time, we had a really good op-ed that was written by Secretary Sebelius, then HHS Secretary Kerry, and Lisa Monaco, President Lisa Monaco, Assistant to the President Lisa Monaco. So this was a pretty important event, and we wanted to raise the level of attention to it. We also had Director Chan from the World Health Organization host a video conference in Geneva, where she invited a number of ambassadors in Geneva to sit in and be part of the GHSA launch. She also had there the Director General of the Food and Agriculture Organization and the World Organization for Animal Health. So this slide is a way to help all of you understand the different parts of the government that are involved in GHSA. Of course, you have the National Security Council, the White House, which was pulling together all the different threads within the government, but you also had all of these other departments and agencies and centers that were involved. And the important thing about this is not only that we had these entities involved in the U.S. government, but when we work with other countries to this day, we encourage them to also have a whole of government approach to their work. And so whenever we have meetings with government entities on the GHSA, they are always encouraged to bring the representatives from their different equivalent ministries to also be engaged and have a whole government approach to GHSA. Today, the GHSA, as you can see, this slide, 55 countries. I've just been informed that actually there's over 60 countries now that are part of the GHSA. And if you look on the right, you will see that these countries come from around the world, from many, many different parts of the world. And the countries who are in green are part of the 10-country steering committee. And this steering committee meets about 3 to 4 times a year. And they meet to really just go over any issues, to talk about the process of implementation, and other kind of things that will help to make sure that the GHSA is moving forward productively. There's a mention on the left side of action packages, which I will talk about in a second. These are action packages that the countries are working on together to achieve the goal of strengthening their global health security systems. And there's 11 targets which are part of the action packages, which I will go over in a second. The other things to highlight on the slide is the emphasis on multi-sectoral cooperation, which I already talked about, the emphasis on One Health, and you also see a number of advisory partners to the GHSA. There's also a ministerial that takes place every year. This year it's going to be in Bali in November. Last year it was in Uganda. Before that, it was in the Netherlands. And then it was in South Korea. And the first one was in the United States in 2014. These are the action packages that I was just referencing. And as you look through these action packages, the important thing to note is these are the prevent, detect, and respond. So the blue are the prevent action packages. The kind of yellow, greenish is the detect, and the purple, violet color are the respond. And these are the action packages that countries have all agreed to, and to be a part of GHSA, a country has to agree to be part of at least one of these action packages. And the country can decide for itself which one it wants to be a part of. But they have to be part of at least one, so these are part of several. And these action packages were developed with the understanding that a country would need to do at least these minimum things to say that it is ready and capable of dealing with an infectious disease threat. So as you can imagine, that when Ebola happened in 2014, the countries in West Africa were not have said that they were able to meet all of the needs that are within these different action packages. So these are the things that the countries have agreed to for the GHSA, and these are the things that countries are working on together. A little more information about the action packages. Each action package, and if you go to the website gshagenda.org and you pull up one of the action packages, you will see that each action package has a 5-year target. It has measurements for how you will measure whether you are meeting your target. It has leading countries and contributing countries, which means these are countries who have decided that they want to take the lead in ensuring that countries are abiding and living up to and meet the needs and requirements of the targets for the action package. There's a 5-year plan, and then there's a baseline assessment and planning activities. So these are all part of action packages. These are all part of implementation for the GHSA. And these are action packages that all countries have to abide by to say that they are able to prevent, detect, and respond to infectious disease. One thing to also think about is what happens now after countries have agreed to the action packages. What happens at this point? Well, one thing that we needed immediately was a baseline. We needed to get a sense of where countries are at this moment in terms of their global health security capacities, so we would know what they need to improve. And so this is done by these joint external evaluations, JEE, which consists of experts that go to a country and sit down with the ministries for a week and ask a number of countries based on the different the 11 action packages. And based on those responses, countries are given a red, a yellow, or green in terms of what they need to do to improve their capacity in the different action packages. So they might get a red, a yellow, or green in action package 1 on AMR, antimicrobial resistance. And based on whether they have a red or yellow, it will tell them what they need to do to get to green. After they have the JEE, they do a 5-year roadmap. And this is something that's worked with the government, with experts. It has representatives from international organizations, and they develop a 5-year roadmap on each one of the action packages, detailing specifically what they're going to do each year to get from red to yellow to green. And then they next have to implement the roadmap, of course. And then at that point, it's a matter of going back and assessing how the country is going during the 5 years. One thing I also want to point out here before I go to the next slide is it was realized early on that we needed to add in more things to look at when we're sitting down with a country to do a joint external evaluation. We had the 11 action packages, but there are about 8 other things that we realized we need to look at to help determine whether a country is ready to prevent, detect, and respond to infectious disease threats. So I have a slide that I will show you in a second that has the different, the additional packages. I believe it's in the slide deck. Anyway, for the external evaluations, one of the things that this is really useful for is these are not only based on external experts from outside the country that sit down with the country to determine where that country is on its abilities to prevent, detect, and respond to threats, but it also provides a baseline for others who have an idea or have an interest in doing work in a country. And so these JEEs, and we have over, I believe, much more than 40 now, they're posted online, and you can look at them and see where a particular country is in terms of its baseline based on red to yellow to green. But we were quite amazed at how many countries wanted to have this done, because it actually was done, they were being done free of charge, essentially, where the country was not, we were paying for the experts to go out there. And so the countries really realized that these were important. And they realized that it would really help them understand what they needed to do. And it also helped to build a collaborative process in the country. Very often, ministries didn't really talk to each other. This forced different ministries to sit down around a table and really get an assessment of what each one does and what the capabilities are and what the capabilities weren't. And this meant opening up some of the things that I wanted to share, but it really does help the country itself by everyone sitting down and having this collaborative approach. This slide shows the 11 action packages, but the 8 additional issues that I mentioned earlier. So the ones that are in red are the ones that were not part of the original action package, but these are the additional issues that were added because we felt we needed to ask more questions on the JEE. So you see things like food safety, which makes a lot of sense. And then we added some of the other things like coordination, communication, advocacy. And you could even see on the right where you have other IHR-related hazards, chemical events and radiation emergencies. These are other things that we saw were missing and needed to be part of the question. This slide basically shows an example of one of the action packages. This is Action Package 3 on prevent. And the reason I'm showing this one is just for you to get a sense of when I say red to yellow to green. Red means obviously no elements in place at the time. Yellow is developing a comprehensive biosafety system. And then, of course, green means the country has developed a system of biosafety and biosecurity. So based on the questions and the answers received by each country, this is how the experts will look at the questions and compare them to the red to yellow to green to determine where a country is on each one of the action packages. And this is just based on one particular country, just to show visually what it looks like in terms of countries going from red to yellow to green in a 5-year period. This slide is an example of a roadmap, and it is showing country in this particular case biosafety and security, what the country is going to do in year 1, year 2, and of course there's other pages to this, and I think some of you might have seen this if you looked at the Sierra Leone example. And of course it lists, what the U.S. government's going to be doing, what other host government entities are going to be doing within that country, and then others. You could have foundations here, you could have international organizations, you could have academic institutions, you could have the private sector in here as well, and the other entities. But what this shows is not only what a country is going to be doing each year, and not only what government activities are going to be taking place, but also it reflects the fact that through this process, you can have a very strategic view of what each entity is doing for the country. So if you have if your NGO or your business is working in a particular country, you would hope that you're listed in here in terms of things that you might be doing to help that country. And this is a way to try to figure out how you can get involved. And I'll talk a little bit more of that in a second. This is just to show that this JEE Alliance was established following the fact that there were so many countries asking for a JEE. There was really no process for figuring out how to do that. I mean, when there was 1 or 2 or 3 countries, that was easy. But when we started getting 60 countries that wanted a JEE because they realized how valuable they were, how valuable they are, we realized we needed a new structure. And so a JEE Alliance was established that would set up a list of continuing experts, that would set up a process for funding. So we went out and had entities like the Gates Foundation decide to provide some funding. So this was really just another process that was set up because of the value that countries realized they were getting from having a JEE. This slide is just to show, and apologize, some of the words are a little jumbled there, but the point of this is to show that this alliance is made up of countries, but also those entities outside government. And you'll see quite an interesting list of countries who are involved in this. So this is another process showing the whole of government, whole of society approach to GHSA. And this is just to show some of the countries who are on the advisory committee and those who are part of the non-governmental sector who are part of the advisory committee. Okay, how was all of this funded? For the U.S., we were able to obtain $1 billion in 2015 for GHSA. The majority of this money went to CDC and USAID to address the Ebola crisis, but this was the money that was really set aside for GHSA, and this was really great because it provided additional funding for CDC to put more people out there in the field, to provide more money for USAID for all of its predict type projects and things like that. So it was really useful funding. We've had some problems with this recently because some of the money from this was taken for Zika. And then we've had some back and forth with Congress for some of the money that was left over, because we're looking for additional money now. So suffice it to say that this was a good amount of money. Obviously, we can't resolve the global need to strengthen global capacity in health with $1 billion, but we were able to leverage that and work with our G7 partners to also get additional funding. I'd like to move on briefly toward the end of these slides, just talking about some of the GHSA work with the non-governmental sector. There's a number of entities that's been established since 2014. One is called the Global Health Security Consortium, and these are all entities that you can get involved in if you would like to. The consortium is really made up of all the different entities outside government. So you will see academic institutions, private sector, foundations, a number of other entities who are part of this consortium, which has a steering committee, which has conference calls once every 2 weeks. It follows the work of the GHSA. It sends representatives to the GHSA steering committee meetings. They attend the GHSA ministerials. And so this is a way to ensure that we continue that whole of society approach. Next is a GHSA Private Sector Roundtable, which was established really by a number of entities that realized that during Ebola, a lot of private sector was called on to do a number of things. Unfortunately, they were often asked to do things they don't do, asked to give certain type of gloves, for example, that they don't provide. So what they wanted to do is try to fix this and make sure for the next time there's a global health crisis, that there's a better understanding of the supply chain, a better understanding of who does what, there's better coordination amongst the private sector. So they established something called the PSRT. Very active, I must say. It has a number of working groups that you can see in front of you, including partnerships, supply chain, antimicrobial resistance. So if any of you are interested in that, I have put at the last slide some contact information. Then there's the Next Generation Network. We always have to, of course, concern ourselves with the youth, since they will be the ones to carry this work forward in the future. It's a global network, very active. They attend all the ministerials. They attend the steering group meetings. They're very engaged and very involved in the GHSA. And then there's been outreach to foundations, which would make perfect sense because they do so much work in health, global health. So we need to make sure that they are a part of the ongoing discussions. How can you contribute to GHSA? Well, there are a number of ways to look at GHSA to see what role you can play. And I would like to highlight here the JEEs and the roadmaps. And what I want to note is that these are, there's a reason why we put these online. There's a reason why we wanted to promote transparency, even though there were some countries, even the US at points, that did not want to put their JEEs online and the roadmaps online. It's really to help promote a more strategic effort globally in how we are helping countries strengthen their global health security capacity. So we want entities to know what countries are doing that they may be already doing work in. We want entities to know if you're interested in doing work in a particular country, look at the JEEs, see what the gaps are, and look at the roadmap to see what's actually going to be done to try to address those gaps, and see where you fit, and see whether you might be doing something that's already being done by somebody else. But we really do put it on the site for others to take advantage of, and we encourage entities like yours and others to go to the website and get involved. if you're already in a country where you see the JEE is taking place, and you know you're doing work and you don't think it's captured in the JEE, for example, you could talk with your counterparts in that country and say, you know, well, we know that your country's involved in this. You know, you can talk to the U.S. embassies, because we have CDC, USAID, of course, State Department people, a lot of these entities where they're following the work, working directly with the ministries. But this is really for you they're really for you to work, look at, and see how you want to be engaged. And I captured some of that in the third bullet there. As I said, you can use these to reduce overlap and make sure that what you're doing is not being done by somebody else already. It helps you to plan strategically for what you may want to do. You may want to reach out to entities, like if there's a foundation that's doing work in that country and you want to know more about that, it's a way to find out what they're doing. And you can also be a part of some of these things like the GHSA the Roundtable, or if you know young people who might be interested in being part of the next generation, that's another thing you can do. You can also be part of the ministerials. They're open to different entities. So if you wanted to even get more engaged and go to one of the ministerials, you would, if you're a private sector entity, you could contact the Private Sector Roundtable folks, or if you're another NGO, talk to the consortium. So there's ways, it depends on how much you want to get involved. You know, it's really how much you want to get involved with the work. Here are some contact information. I've listed mine. Ashley Arbasati, who is currently the chair of the Global Health Security Consortium. Also Tina Flores, who's from Raven Martin, and she is the current secretariat for the Private Sector Roundtable. So these are all individuals that you can get in touch with if you want to get more involved or more information on what these different entities are doing. So with that, I believe I've talked for about 25 minutes. So I hope that you enjoyed those slides, and I am more than happy to answer any questions. Thank you.
Thank you so much, Bonnie, for a really terrific presentation. If anybody has any questions, you can go to the bottom of your screen and you can type them in with the Q&A function. We do have one question, and it is, as a donor, how can I use the country roadmap to evaluate investing with an NGO?
To do what? What's the second part?
I'm sorry, to evaluate investing with an NGO.
I'm assuming from the question that you're speaking of investing in an NGO in country.
Yes.
Okay. Well, what I would do is if you look at roadmaps and let's say you're seeing that you're looking at biosafety, biosecurity, and you're looking at, let's say there's an entity that's actually doing work in that country. I mean, you could, of course, contact, there's no evaluation per se listed of countries, but if you want to get more information about that particular entity, one thing you might want to do is contact the consortium, because they may know, there may be somebody on the consortium who will have information about that particular entity, because the people on the consortium, there's over 100, maybe 150 entities that are part of the consortium, and they also have their own connections. That's one way to do it. There's also, if necessary, you know, the consortium can reach out to our State Department colleagues who have colleagues overseas in those countries and get that kind of information. You also may want to look at the success stories, because there may be something written on that country related to some of that particular work mentioned, those NGOs. So I think those are some of the avenues that I would do, that I would take in terms of getting a little more information about the NGOs on the ground. I would make use of the networks that exist to get some of that information, and the consortium is certainly one of those networks, as well as the Private Sector Roundtable, who may also know a little bit about the NGOs. Thank you, Bonnie.
Here's another question. How does this dovetail with the UN SDGs?
Great question. We always get that question. Thank you for that. when we were envisioning the GHSA in 2013, we weren't thinking about the SDGs. I don't know when the MDGs became the SDGs. I have to remember that. May have a factor in that. But we were not focusing on the SDGs. What we were focusing on was World Health Organization international health regulations. And we were focusing mainly on that because we realized that in the following year, in 2014, countries were obligated to inform the WHO as to whether they could say they were living up to the requirements of the IHRs. And we knew that less than 30% of countries could say yes in 2013. And so that really was, I think, really captured most of our attention. And you know, it kind of turned out that that was true because Ebola happened right after that, and we know that those three countries were certainly not able to say they could live up to the IHRs. So I would say that's probably the main reason we were focusing more on that, and not so as much the other development issues. I will say that in the SDGs, under the health SDG, there is a reference. They do talk about infectious disease. And so naturally, all of the work that's being done on GHSA to strengthen global health capacity and country capacity in global health and infectious disease will certainly be something that's strengthening what they're doing, what each country is doing under its SDG obligations.
Thanks, Bonnie. How can GHSA be used to strengthen disaster relief response?
Well, because I think a lot of the things that we're learning in terms of response for infectious disease are certainly things that countries can use in terms of other disaster response. So when we strengthen workforce development, which is one of the action packages, which is, you know, of course, making sure you have enough of a workforce, including not just doctors, but emergency response. There's one of the action packages talks about multisectoral, which is for us, the FBI working with doctors, you know, and it would be the same for other countries, whatever their FBI equivalent would be, maybe their security force or whatever that would be. You know, so there are certainly things in the GHSA action packages that as countries strengthen their capacity through those action packages, they're also training some of the same people who might be involved in other types of disasters and also strengthening the infrastructure. So you're certainly, even though it's focused on global health and infectious disease, you're certainly going to be strengthening their capacity on other issues and other disasters as well.
Thank you. You mentioned the consortium and the private sector roundtable. As an NGO, is that the best way to get access to GHSA? Is there an annual membership fee?
I don't believe there's an annual, well, let me just rephrase it. I am not sure, because at the time when I was most engaged with them, and I left government last year, they're going strong, so much stronger than they were then. I'm not sure. I can find out. I can, and you can also email Tina directly. There might actually be some kind of financial commitment.
Okay.
Yeah, I would think maybe something. I don't know how large that would be, if there is something, but there might be.
And is the consortium and the private sector roundtable the best way to approach GHSA? And
I think so. If you're new and you're trying to get a little more information on GHSA, you know, after you've done the usual searches on the internet and you looked at the GHS agenda website, that's the best way to do it, because a lot of the people who are still in the consortium, and now I'm a consortium member, but now on the NGO side because I'm not in government anymore. That's the way, because the consortium has a lot of interaction with State Department, with CDC, with HHS, with all the different government entities, and it also has those entities that are actually doing the work outside government. And same for the PSRT. You're going to have a number of businesses, everyone from Johnson & Johnson to GE to Merck to Coca-Cola to UPS. They're all involved in GHSA, the Private Sector Roundtable. So I would certainly use those as ways to get more information and to get more involved.
Thank you so much, Bonnie. Thank you so much for taking the time to speak with us about this. It was a terrific presentation. For those of you who are interested in continuing the conversation, we will be having discussions on the community of practice. It is cop.pqmd.org. You can click the discussion forum button on the right side of the site and you can enter into the forum if you have any further questions or you would like to discuss any of the topics that you heard about today further. Bonnie, thanks again for taking the time to present to us. It was terrific, and in the coming months we will be having more webinars about various topics. In this summer, we'll be having one on the pandemics and the poor. Please stay tuned. You'll be receiving information. And again, thank you so much for taking the time out of your day.
Thank you all.